As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
And now joining us for To Your Health with Terrebonne General Medical Center is Dr. Ben Adams. And Dr. Adams is the medical director of anesthesia services at TGMC. And Dr. Adams, we welcome you to the program tonight. As we know, the topic will be that of anesthesiology. And just to educate our viewers, if you could just explain again to us what that big word anesthesia really is.
Right. Anesthesia is a term that encompasses quite a few things. In its truest sense, anesthesia is a state in which we render the body insensate to painful stimuli. More simply put, we can operate on people without them feeling pain. There are multiple parts to anesthesia. We have anxiolysis, which is medication we provide to patients prior to surgery to prevent any anxiety of undergoing that procedure. We provide anesthetics in the operating room, which put the patients to sleep and essentially turns off the brain during the procedure. And then we also administer analgesics, which are pain medications that prevent the person from feeling pain during the operation and afterwards.
Okay, and in speaking about that, are there actually different kinds of anesthesia?
Right, there are three major types of anesthesia. One would be local anesthesia, which is used typically for minor procedures. Maybe we'd be taking a mole off or removal of a small skin lesion. That medication would be directly injected into the site where the surgery would be performed. Next would be regional anesthesia. Regional anesthesia involves anesthetizing, exactly like it sounds, a region of the body, whether it be one arm or a leg, or maybe the abdomen for some type of abdominal procedure. Medications injected around groups of nerves that provides anesthesia to that part of the body.
Okay.
And then lastly, we have general anesthesia. And general anesthesia is the term that most people are familiar with. That's where we provide medication either through an IV or by way of breathing it. That medication puts the person to sleep, renders the whole body insensate to any portion of the operation, and it'll block pain signals that from the body, blocks them from registering in the brain.
Okay, and for what procedures are the different kinds of anesthesia used?
Okay, local anesthetic, which is the first one we talked about, is typically done for very minor procedures. Removing a toenail, suturing a small area, maybe you have a cut on your finger. We inject medication directly into that site, and that site becomes numb and allows us to do the procedure with no pain associated with it. Okay. Regional anesthesia is most commonly used for orthopedic procedures. It can be used for C-sections, by way of epidurals or what we call peripheral nerve blocks, where we inject medication directly near a nerve. Potentially for a shoulder surgery, we would make an injection above the collarbone near the neck, and we would render the whole shoulder and arm numb for the procedure. And then lastly, general anesthesia. There are a number of procedures that we have that regional anesthesia is not appropriate, and local anesthesia is most definitely not appropriate. Those procedures are typically going to be abdominal procedures or chest procedures, heart surgery, lung surgery, laparoscopic procedures where we fill up the abdomen with carbon dioxide. Those are types of procedures that are only tolerated under general anesthesia.
Okay, and what determines the kind of anesthesia you actually use?
The way I go about determining an appropriate anesthetic for a patient is there's several things that happen prior to undergoing anesthetic. One, we do a history and physical exam on every patient that we see. By way of the history, we can determine what types of medical conditions those patients may have. Did they have any previous surgeries? If so, what types of anesthetics did they have with those surgeries? And did they have any type of complications associated with the anesthetics? That kind of tints our direction for our anesthetic. Then from there, we move on and we think, well, what's the safest or best anesthetic for this patient to receive for whatever type of surgery they're going to have? And I kind of mentioned some of the procedures earlier that help us to determine which type of anesthetic to use, but all of those things play a part in the type of anesthetic, as well as major medical conditions, heart disease, smokers, COPD, things of that nature. And once again, allergies.
And Dr. Adams, how do the anesthetics, once they're administered, how do they actually work in the body?
Well, the way the body works is that anytime we feel a painful stimuli, whether we burn our hand on the stove or we cut our finger in the shop, that pain signal is sent directly from the injured portion of the body by way of nerves to the spinal cord, and from the spinal cord directly up into the brain. The brain registers that something bad has happened to the body, and we sense that and we feel that as pain.
Okay.
The purpose of the anesthetic is to prevent the body from getting that signal from the painful spot to the brain to register that you're having pain. The local anesthetics or regional anesthetics, they block those signals in the nerve, which is just like an electrical signal in a power cord. We cut off that signal so the brain never realizes that there's anything going on to the extremity.
Okay.
With the general anesthetic, we actually put the brain to sleep, for lack of a better term, and that prevents registering of those painful stimuli directly in the brain. So two different mechanisms for the different types of anesthetics.
Very interesting. Dr. Adams, what we'll do is we'll take a short break. When we return, we'll discuss more regarding the effects and the risk of anesthesia once administered. That's coming up next.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
Welcome back to Your Health with Terrebonne General Medical Center. And joining us again is Dr. Ben Adams, anesthesiologist. And Dr. Adams, we talked a number of things about what, the different kinds of anesthesia used and things like that. If now we can talk about whether there are any risk once you are put under, anesthetics.
Well, first and foremost, anesthesia is very safe. 20 or 30 years ago, it was less safe, but advances in medicine and monitoring techniques have made us a very safe specialty. Each type of anesthetic carries some amount of risk. As far as local anesthetics go, the risk associated with that would be an allergic reaction to one of the local anesthetics or the numbing medication. That medicine could potentially be injected into a blood vessel rather than just into the tissue. Typically, that's a very minor type of reaction. You may have some ringing in your ears or a metallic taste in your mouth. If you've had epinephrine, you may feel like your heart's racing.
Okay.
That's one adverse reaction. With regional anesthetics, we're injecting medications around nerves. Same thing can happen. We could inject it inadvertently into a blood vessel where it shouldn't be. We could inject it directly into a nerve, which would cause prolonged numbness. And allergic reactions are once again a problem that could occur with that as well. General anesthetics carry additional risk. Most common things that you would see from a general anesthetic would be a sore throat from having a breathing tube that's placed after you're asleep. We work around the face. There's always potential that we could scratch your face. Some people have episodes where they may have what we call corneal abrasions or scratches on the eye, because once you go to sleep, we have your eyes and we tape them closed, but you're not blinking, you're not awake. If there's a small particle there that could cause an abrasion. It's uncommon, but it is a risk. And more commonly, we see nausea and vomiting after general anesthetics are performed. But once again, it's relatively safe procedure. The risk of something major like having a stroke or a heart attack or dying from anesthesia is very, very small. It's way less than 1%.
Oh, wow, that's reassuring. Are there any long-term negative effects of the anesthesia?
The patient population that we see those negative effects in would be our elderly patients, those patients that are over 60 to 70 years of age. A large portion of those, about 25%, are going to suffer some amount of cognitive dysfunction. It's a big term. What does that mean? Well, it means that those patients, they're going to seem a little slow after the anesthetic. They may be slightly off. Maybe they can't put their finger on exactly what it is. Maybe they have some slowed memory, can't recall specific events. Typically that resolves, and in a very small portion of those patients, it does not resolve and can last for several years after the anesthetic. But once again, the patients that we put to sleep in that age group, typically we try to minimize the effects of anesthesia by choosing techniques that limit the exposure to the general anesthetic. But there are times where we have emergencies in that patient group, and we have to proceed with the general anesthetic, and it may be a prolonged procedure, which increases those risks.
If I were to go on, have a procedure done that would require anesthesia, how would I know how the anesthesia would affect me?
Anesthesia is a very well studied topic. The drugs have a relatively safe profile when administered by an anesthetic professional, whether it would be an anesthesiologist or nurse anesthetist, which we employ under our direction at Terrebonne. Pre-existing medical conditions can affect the way the anesthetic works. Some of those things would be heart disease or lung disease, smoking, alcohol use, pain medication use, any allergies, which we've talked about previously. But some of the more important ones that impact us negatively would be those patients with obesity or sleep apnea. We take a patient, we administer medications, we take over their functions, we take over their breathing, we take over their blood pressure, their heart rate. Well, in those larger patients, it becomes much more difficult for us to secure their airway and to maintain adequate breathing for those patients. But given the patient's history, we can often come up with a very safe anesthetic plan for those patients.
So it's important, I guess, to make sure you give a detailed history to your doctor.
Very much, and a very honest medical history.
Right. How do you prepare to go under anesthesia?
Okay. Prior to every anesthetic, you're going to meet with an anesthesia provider. It may be a physician like myself, or it may be a nurse practitioner that works in a preoperative clinic, or even a registered nurse anesthetist. They'll perform a history and a physical. They'll go over your medical history, and we may order a lab test that would be appropriate for your medical history, which can include blood work, potentially a chest x-ray if you have some sort of lung disease, or an EKG if you have a history of heart disease. We would evaluate those tests, make recommendations, potentially order further tests, but that helps us determine how to proceed with the anesthetic. So you could expect to undergo some lab tests. You'd be instructed on which medications to take on the day of your surgery, which medications not to take on the day of surgery. And also we would give what we call NPO instructions, or the instructions for when not to eat prior to coming to the operating room. Typically, the rule of thumb historically has been nothing to eat or drink after midnight prior to your operation. There is some variation to that, but it's greater than what we're probably going here today.
Okay, very good. And the ultimate question everybody wants to know, will I remember the surgery while under anesthesia?
Right. In recent times, there have been movies about this topic.
Yeah.
The incidence of what is referred to as awareness while under anesthesia is about 1 in 5,000 to 1 in 15,000. So once again, a very low percent. There's a special group of patients that are more at risk to experience anesthetic awareness, and those would be patients undergoing heart surgery, because in those patients, number one, they have a sick heart, otherwise we wouldn't be operating on it, but we kind of walk a tightrope between administering an adequate depth of anesthetic and not killing the patient. Emergency C-sections, where we have a mom and a baby's life that could potentially be at risk, and the way we administer medications typically is very rapid, and we proceed to surgery in a very quick fashion, which could lead to some amount of recall from the very beginning of the surgery. And then also trauma patients that come in with major blunt trauma, potentially gunshot wounds, lots of bleeding, and low blood pressure. Those patients are also at risk for having some amount of anesthetic awareness. Now, we could prevent that several ways. Number one, in the choice of medications we use. At our facility, we also utilize a monitor that we place on the forehead that monitors brain waves and brain activity, so that we can adequately assess the depth of anesthetic and see that the brain is in a lesser state of awareness, or shut off, for lack of a better term.
Okay, well, Dr. Adams, very informative information. We appreciate you joining us here for To Your Health with Terrebonne General.
Thank you very much.
You're welcome. Okay, that wraps up To Your Health with Terrebonne General in the segment for tonight. We'll take a short break, and we have more for you tonight on Bayou Time. Stay with us.